Hey, my name is Dr. Sean Price, Clinical Coordinator here at the Fix in Fort Walton Beach. Shooting a series of videos here just to help you understand what you're going to see and what you're going to learn in our free adrenal recovery class that's going to be coming up here in the next couple days, and you'll see that on the post along with this of when the date and time. We talked about sympathetic and we talked about parasympathetic dominance. We talked about the hypothalamic pituitary adrenal axis and how you can understand how this fires that can get you into sympathetic dominance. We also talked about the causes. Now, one of the things on here that I kind of want to mention, and we're going to again go into this in great detail in the workshop so that you really understand this, but metabolic challenges, you can be the healthiest, most calm and peaceful person with no physical or emotional stresses. You've got a completely clean, chemical-free environment. But if you don't maintain your blood sugar and you don't prevent sugar dysregulation and blood sugar dysregulation, that metabolic stressor can in fact cause issues with the adrenal glands. Our blood sugar, we have a normal range, and what will happen is we get hungry and we eat, and then we go back down, we get hungry again, so that's a normal process. What a lot of patients deal with is they deal with when they eat, their blood sugar goes too high, and this comes from either current issues with eating the standard American diet and eating too many foods that cause that blood sugar to raise up, or it could come from just dysregulation because the body's not responding appropriately to the food that's coming in. And then when we come down, we're supposed to go here, but a lot of patients will either go down here. So some patients suffer from this, some patients suffer from this, some patients suffer from both of these. This situation is a constant stressor on the adrenal glands. So again, even if you've handled all of these stressors, this blood sugar dysregulation will cause adrenal stress. So blood sugar is going to be a big part of what we talk about. One of the things that I commonly hear from patients is my blood sugar is fine. They ran my test and my fasting glucose is fine. The challenge with that is you can have this dysregulation going on for years and years and years before your body finally starts to exhaust itself and fatigue to the point that it can't maintain your fasting blood glucose level at a good level. So if your glucose levels are actually starting to rise or going too low, and you're being diagnosed with hyperglycemia or hypoglycemia, that means this has been going on for 10, 15, 20 years. If your blood sugar levels are good, but you're feeling symptoms of irritability, hot flashes. If you don't eat, you kind of start feeling you're agitated and get shaky. You're fatigued all the time. You have that 3 o'clock lull. You're inflamed. You're in pain. All of these things could indicate blood sugar dysregulation, even though your blood sugar is normal. So there are things that we need to do to evaluate to make sure that's going okay, because this will lead to adrenal fatigue. It will also lead to thyroid issues. All right, and again, we're going to go into this in a lot of detail in the seminar. If you haven't already registered, please feel free to do so. And we'll see you on the next video.